beginning. Let me know if I miss anything. All right, so I'm going to walk in and say, hi, my name's Amy. I'm going to be your nurse today. Can you tell me your name?
Julie.
And what brings you in?
Just my routine yearly physical.
Okay, perfect. So a few questions I'm going to ask you before we get started. Do you need to use the restroom before we get started? Okay. Do you know what the date is?
It is November 19th,
I think it's 20th.
the 20th. What day is it? It's the 20th.
Well,
It is
who's the President of the United States?
President Trump.
Okay, good. And then I would take her vitals, get her height and weight and all that basic stuff at the beginning, and do just a quick run through of any current medications that you're taking, any allergies, some of that basic stuff, okay? All right, and then I'm gonna go ahead and get started, and I've already kind of looked at her appearance, her behavior, and then I'm gonna go ahead and start at the top. I'm gonna work my way down and compare side to sides, okay? All right, so I'm gonna feel around top of her head, her scalp, any lesions, lumps, bumps, scars, infestations, cleanliness, all that good stuff, okay? And then I'm gonna feel around to see if she has any issues with her lymph nodes, any tenderness. Okay, perfect. And then I'm gonna come to her face and I'm just gonna get an overall, I'm gonna look to make sure everything's symmetrical. There's no drooping, there's no twitching of eyes, her cheekbones are pretty symmetrical, her ears are symmetrical, her eyes, and that's gonna tell me cranial nerve what? Let's add to this. Go ahead and raise your eyebrows. Okay, smile, frown, puff out your cheeks. Which cranium? Cranial nerve. Okay, cranial nerve 7, facial nerve. Okay, now what I'm going to do is I'm going to go ahead and come over to her eyes, and I'm going to look at the external part and just make sure there's no redness, no drainage, crustiness, anything abnormal. Okay, I'm also going to look at her conjunctiva, and I'm going to make sure it's pink and moist. Okay, color of her sclera, and then after that, I'm going to go ahead and test the cranial nerves 3, 4, and 6, which are what? Oculomotor, trochlear, and abducens. Okay? And by doing that, I'm going to check Perla. So I'm going to check and make sure her pupils, go ahead and look at an object straight ahead. I'm going to check and make sure her pupils are round, reactive to light, and then I'm going to make sure they accommodate. Okay? Now what I'll have you do, I'll just have you turn towards me. Go ahead and look at my pen and follow it with your eyes. Okay? I kind of went sideways a little bit. But she had accommodation, so again, 3, 4, and 6 are intact. Now I'm going to have you watch my pen and follow it with only your eyes. And this is your 6 cardinal gaze. And her eyes are not deviating at all. They're following perfectly. Good. Okay. All right, so I've done everything with the eyes. I'll have you turn a little bit. So now what I'm going to do is I'm going to go down to her nose. And it doesn't matter which one you do first, okay, as long as you're making sure you get to every one of them. Again, I'm going to look at the external features, look around, make sure she doesn't have like a bloody nose, runny nose. Can you go ahead and occlude one nostril and breathe and do the same thing the other? Perfect. And if they have oxygen, you want to make sure and remove that so you can see if there's any breakdown of the skin. And then I'll look inside, and really I'm just looking to make sure that her septum is intact, it's midline, it's not deviated. I don't see any polyps or anything concerning like that. Okay? And then I'm going to have you close your eyes. Tell me what you smell, just to make something up.
Lemon.
Lemon, okay. And I'll have stuff for you guys when you check off so you can actually say what that is, okay? All right, so that's cranial nerve 1, olfactory, okay? Now what I'm gonna do is I'm just gonna kind of press around her sinuses a little bit and just make sure there's no tenderness, okay? And then what I'm gonna have you do is close your eyes and tell me if you can feel, yep, okay? And we'll have cotton swabs for you guys to do that. Go ahead and close your eyes, clench your teeth. Okay, perfect. So that's cranial nerve what? Okay, that's trigeminal. Okay, now what I'm going to do is I'm going to come down to the mouth, and again I'm going to look at color, shape, make sure there's no sores, make sure that there's no cracked lips, all that good stuff. And then I'll have her open her mouth, and I'm just going to look around. Go ahead and lift your tongue up. I'm looking underneath. I'm looking at her gums. If your patient had dentures, make sure they take them out so you can look at the skin underneath. I'm making sure that her mucosa area is nice and moist and pink, and it's not dry and sticky. And then I'm going to go ahead and open your mouth, and I'm going to look in the back of her throat, and I have a tongue blade. Perfect. Okay, so she's able to, her uvula moves back. She's got a good gag reflex, which we'll just say, obviously you don't need to do that. And then can you swallow? Okay, so what was those two cranial nerves that I had doing the and gag reflex? Glossopharyngeal and vagus. So cranial nerve 9 and 10. Okay? All right, and then I'll have you stick your tongue out and go side to side. Okay? Cranial nerve. What's that? Cranial nerve 12. Okay? That's your hypoglossal. And then I'm going to go ahead and now what I'm going to do is I'm going to check her pulses, temporal pulse. Perfect. And then I'm going to go ahead and make my way down, and so I'm going to feel her neck. Go ahead and swallow. Okay, and I don't feel any enlarged thyroid, so there's no goiter. She's swallowing good. Then I'm going to check her pulses one at a time, radial pulses. Good, perfect. Okay, so now from there what I'm going to do is I'm going to go ahead and do her upper extremities. And so as I'm going down and I'm looking, I'm feeling, I want to look at color, I want to feel for moisture, temperature. I'm going to check skin turgor. You can do it on the wrist, do it on the hand, and I'm going to do that on both sides, okay? And then I'm going to come down to the hand, and I'm looking in between fingers, fingernails, checking capillary refill that needs to be wet.
Less than 3 seconds.
Okay, less than 2 to 3 seconds. Okay, I'm looking at all that, everything looks good. I'm doing it the same thing to the other hand, and then I'm going to check her pulses bilaterally because you want to make sure they're equal. They're good. Okay, now what I'm going to have you do is some fine finger movements, so go back and forth with your fingers. Perfect. Okay, because you're kind of doing all this at once, everything that we've done. Okay, range of motion, fine motor movement. Okay, can you move your wrists around? Good. Now I'm going to check your strength, so go ahead and hold your arms out. And I'm using my opposite arms. Squeeze. Perfect. Now go ahead and push against me, and then I'm going to push against you.
Oh, no, so I'm
Push,
resisting.
pull.
So push and then
And
pull.
pull.
Got
Okay,
it.
perfect. Okay, so I got all that. Then I'm going to come around, and I'm actually going to start posteriorly. Okay, and again, they'll have a gown on, so you want to make sure you look under the gown, because we want to look at, again, color, any hair distribution, moles, scars, anything like that you want to document. Okay, and after I do that, I'm just going to go ahead and palpate, make sure she doesn't have any tenderness anywhere. Okay, and there's no lumps or bumps. Okay, and then what I'm going to do is I'm going to have you breathe in and out. So you're checking to make sure that chest expansion is good. And while I'm back here, I'm going to go ahead and do the CVA to see if there's any tenderness in the kidney area. And then I'm going to come along and I'm going to listen to her lungs. Okay, I've looked, listened, or looked, felt, now I'm going to listen. You're going to start at that second intercostal space. Again, you want to make sure you're not over the clavicle, okay, or collarbone, sorry. Scapula, gosh dang. Okay, so what I'll do is I'll have her take a full inspiration in and a full expiration out, okay? And then I'll move to the other side and we'll do the same thing. And then I'll move down. And you're just gonna show us exactly where you're listening, but you don't necessarily have to have them breathe in and out every single time. You just verbalize what you're doing, okay? Okay, perfect. All right, so I did that. Now I'm going to come to the front and do the exact same thing. I'm going to inspect, and then I'm going to palpate, and you'll tell them to let you know if there's any sort of tenderness. Okay, so I inspected, I palpated, now I'm gonna go ahead and listen. Again, you're gonna go right down to that second intercostal space. And I'm gonna listen again for a full inspiration and a full expiration. And then I'm gonna move to the side.
Sorry.
No, you're good. And you're just gonna keep doing this. And side. And I'm not fully really listening, obviously, but, okay? So now I went through and I've done my inspection, palpation, and auscultation, okay? Everything's good there, so now I'm gonna go ahead and listen to the heart. Again, you're gonna start at that second intercostal space, and you're gonna hear that first sound, that S2 sound, okay? And that's your aortic valve. And then you move straight across to your pulmonic valve. And then I go down to Erb's point, which is third space. And then I go down to the tricuspid valve. And then I'm gonna go down to the fifth intercostal space, mid-clavicular line. And that's where I'm gonna hear my, your apical pulse, which you would listen for a full 60 seconds, okay? So make sure you tell us that you would listen for a full 60 seconds. Okay, everything's good there, so then I'm gonna continue down and I'm just gonna ask questions about the breast area. And I would look underneath and make sure that there's, no dryness, no sores, anything like that. And then I would ask personal questions on, any drainage, sores, odor, anything to that nature. And then I'm gonna go down and I'm gonna go to the abdomen. And this is where you guys will have, because you guys will be doing this in the beds so that you can have your partner lay down. So you'll have them lay down flat. And again, the first thing I'm gonna do is I'm gonna inspect. So I'm looking at the color of her skin, if there's been any incisions, scars, the contour. So you're gonna inspect all that, and then I'm gonna listen, right? Because we wanna listen before we palpate. So I'll start at the right lower quadrant, and then I'm gonna go up to the right upper, the left upper, the left lower, and everything sounds good, they're normal, okay? Which means they're between like 5 to 10, 15 seconds of sounds. Now, if they didn't have any sounds, you would want to listen to each quadrant for 5 minutes each before you say there's no sounds, okay? All right, so I did all that. Now I'm going to go ahead and do a light palpation, and I'm just going to move around to, do you have any pain or tenderness? Okay, and I'm also feeling to see if I feel any lumps, bumps, especially up in the liver area. You want to make sure you're not feeling an enlarged liver. And then I'll go do the deep palpation, so you'll go deeper and you'll use 2 hands. And you'll go through each quadrant. And again, you're not pushing down, you're doing this motion, okay? Okay, so we got done with that. Now I'm gonna go ahead and go to the peri area. I'm gonna feel femoral pulses, and you do that by both hands, okay? Kind of push down and you can feel that pulse more. And then again, you'll ask those personal questions about any problems in that area, okay? All right, so then I'm gonna go ahead and work my way down the legs and the feet. And again, I'm looking at skin, color, hair distribution, any sort of swelling, warmth, all that good stuff. And then I'm gonna feel for the popliteal pulse. And a lot of times it's really hard to find, so you're just gonna verbalize that you're gonna feel for them, okay? And then while they're laying down, I'm just gonna kind of have them bend their knee on both sides to make sure that they have that good range of motion, no pain in the joint areas. And then I'll move down to the feet. And again, I'm gonna be looking at capillary refill. I'm gonna be looking in between the toes, making sure, especially if they're diabetic, we wanna make sure they don't have any sores. And then what I'll do as she's laying down is I'm gonna push on her feet. I'm gonna have her push and pull just to make sure that she has that strength, okay? And then the last thing down here is, and we did the pulses, right? What are the 2 pulses? Okay, so dorsalis pedis, which is on the top, and then on the inside of the ankle is your posterior tibialis, okay? So I've done all that. The last thing I would do while I was down there is I'm gonna check her Babinski, okay? And that's where you're gonna take an object, so like the other side of the hammer, and you're gonna do like an upside down J. And you wanna make sure the toes curl down, okay, for anyone over 2. Okay, so I did all the pulses, I did the full head to toe in this area, and now what I'm gonna do is I'm gonna do reflexes, okay? We've covered the cranial nerves, we've covered all the pulses, and then if you wanna do the reflexes at the very end, you can do it that way, okay? All right, so the first one I'm gonna do is is it easier if I have her sideways?
That would help, at least
No,
the rotates when
You're fine. First one I'm gonna do is her biceps. So you're gonna wanna make sure and secure her arm where your thumb is right there where the tendon is, okay? And then I'm gonna hit with the hammer. Did you guys see that? So you're gonna hit right on your thumb and you want that bicep to flex, okay? And then the next one, go ahead and lay your arm dead there, kind of shake it out. And you're gonna use, again, the pointy part of the hammer right above the elbow there. You're gonna do the triceps. This one can be a little harder to find. Anyways, you'll just pretend like you got a response, okay? Okay, and then I'm gonna come down and I'm gonna do the brachioradialis. So a few different ways you can do this, but if you grab the thumb, I'll do both your thumbs actually. Okay, and then what you have here, you have your styloid process here, that bone, you're hitting up right above that bone, okay? So you pull the arm down a little bit, like this, go above that bone, and that's where you're gonna hit it, okay? And I don't know if I'll get one or not, I'll do it on this side. And you may not. So.
I felt that last.
Okay. All right, so I did those, and then I'm gonna go down and do the knee jerk, okay? So go ahead and let your legs just kind of loosen there. Right below the knee. There we go, I felt a little one there. And then you're gonna go ahead and do the knee reflex. Okay, and then the very last one, and I know this is hard to see. So what you're gonna do with the Achilles is you're gonna hold the foot up, okay? And you're gonna go in the back, the Achilles, everyone knows where the Achilles is, right? And you're gonna hit on the Achilles and the foot should go like this because it's called a plantar reflex, okay? So make sure their foot goes down. Okay, so I did all those, so now all my reflexes are done, so now I'll have you go ahead and stand up and do the very last part. Okay, what I'll have you do is go ahead and just stand there with your eyes closed for a few minutes, okay? Good, okay, and that's your Romberg test. Now I'm gonna have you put your arms out to the side, close your eyes, and go ahead and take one fingertip at a time to your nose. Good, and the other one? Good, and you can go ahead, please. Okay, so I'm also gonna have you do just a few range of motions. So go ahead and put your arms out, go ahead and put them up, go one arm back at a time, and the other one. Perfect. Okay, so it's just, there's a lot of different types of musculoskeletal exercises, but we really just want some basics, okay? Okay, so now what I want you to do is walk from heel to toe to that door, and then you can walk normally on the way back. So we're just, watching her gait, make sure that she has somewhat of a balance, and then walk normal. Okay. Now what I'm going to have you do is go ahead and bend and touch your toes if you can, and I'm going to check her spine, and I'm going to make sure there's no curvatures, or that it's a normal curvature. Okay, go ahead and sit up. Very last thing is what cranial nerve?
11. 1, 2.
Oh, we didn't do 11, did we? Shrug your shoulders, head side to side. Okay, that's your accessory one. But the very last one that you'll have them do is cranial nerve 2. Okay, that's your optic nerve. And that's when you're going to have them stand 20 feet from a Snellen chart. Okay, there's no specific way to do this. If you wanted them to do that at the very beginning, that's fine, or do it at the very end. All in all, just make sure you're trying to go from head to toe and systematic, comparing things, okay? Cranial nerves, do them all at the beginning, get them over with. Make sure you're doing your pulses as you're going through. Don't forget to mention the skin as you're also going through the assessment, okay? And then the reflexes. Any questions?
When we are doing the reflexes, do you want us to do both sides or just mention that?
Just
we-
one is fine.
Okay.
Yeah, yeah, one is totally fine. You're good,
Okay.
sorry.
You're fine.
Thank you, Julie. All right, so